name is Dr. Adelaide Greer, and I'm an audiologist with Lafayette Hearing and Balance. We're located right down Ambassador Café by Women's and Children's Hospital, so not far from here at all. I was born and raised here. I practiced in Houston and recently moved back in February and started working here. I'm really enjoying it. Today I came just to kind of talk to you all about your hearing health care, what hearing loss is, how can it affect your life, and what there is to do about it. Feel free to stop me if you have any questions, and we'll try to cover everything and meet all your needs. So I'm going to kind of follow this little brochure I made. On the front, it shows your ear. What most people don't understand is your ear is actually three parts. So you have your outer ear, what you see, you have your ear canal, and then you get your eardrum, and that's your middle ear. So a lot of people, when they're little, you get an ear infection, and that's behind the eardrum. That's your the middle ear. What I'm going to be talking about today is even further past that. It's in the little snail coil part in the back, and that's called your cochlea. Your cochlea is your inner ear organ, and that's where inside the cochlea it's kind of like blades of grass. There's little hair cells. And they move and they fire to the brain, and that's how we hear everything. Sounds come in, they move, and they go to the brain. Over time, just like when you walk on grass, over time they kind of fall, and they're not as sharp and they don't move as well. That's what hearing loss is. It's damaged little hair cells in this organ, okay? So, now that we know what we're talking about, we're going to open it up. And the top is an audiogram, this little graph right here. That's how we test hearing. Has anyone ever had a hearing test before? Y'all have? Good. So you kind of know what to expect. We play different tones. Some are going to be low-pitched bass tones. Some are going to be high-pitched treble sounds. And you have to say yes or raise your hand every time you hear the beep. What we're doing when we're doing that is testing what's called your threshold, the lowest level that you can hear at all the different frequencies. Once we get your graph, we get to see what type of hearing you have. The top is going to be your normal range, and then it goes down mild, moderate, all the way down to severe. If you see on this graph how there's different sounds of speech on the graph, you'll see that? That is how hearing loss affects your understanding. So say your hearing loss comes here and it falls down, and you're missing all of these sounds of speech in the high frequencies especially, because with age and with life, we lose high frequency hearing first. So that's why you'll notice sometimes the clarity is gone, or it sounds like people are mumbling all the time. We detect clarity from those high frequencies of sound right here. So that's the first step. Anytime you feel like you have hearing loss, the first step is we test your hearing. We get a picture of what we're working with, okay? Does anyone know what the signs of hearing loss are? How would you know if you had hearing loss?
Everybody's mumbling.
Everybody's mumbling. That is the number one answer. That's great. It's our hearing aid pro right here. She's already had her classes. But it sounds like everybody is mumbling, like no one's speaking clearly. You turn your television much louder. So if you have a neighbor that you can hear their television, they probably need to come see me. That's another sign. Another sign is in noise, like in the cafeteria or anytime you're in a restaurant, you can't hear in noise. You have to make people repeat themselves over and over again. In here, it's fine because we really have no background noise. You can typically hear me pretty well. I'm speaking much louder than what a normal conversation level would be. But the minute you get that competing noise, someone with hearing loss is going to have a lot of trouble. So those are the three biggest signs of hearing loss. Now, hearing loss affects 31.5 million people, so nearly 10% of everyone in the U.S. has some type of hearing loss. And also ringing in the ears. Does anybody have ringing in their ears? Like a buzzing sound?
No, I don't have that, but I do have an ear that had to be punctured.
Oh, really?
When I was very, very young. So I'm deaf in one ear.
From that, you probably have some hearing loss from that.
And I can't get water in it or anything.
So it still has a hole in it?
Yeah. but I've always gotten along without it. You know, I've got a big mouth anyway, so I've
You
never
give
had a
everyone your
problem.
good ear
I
then.
have a hearing aid in both ears.
In both ears? Good.
I
And
don't have one right now.
why not?
Well,
That's for another day? Okay. We'll cover that at the next time I come then. So ringing in the ears is another sign of hearing loss, and that is because the nerve that we talked about in that little snail, the little grass cells are damaged, and so you get that ringing in your ears. 80% of people that have ringing in their ears have some degree of hearing loss. Luckily, hearing aids help not only the ringing in your ears, but also the hearing loss. It allows you to hear sounds, focus on the speech, and so your brain doesn't hear that buzzing sound. Sort of like if you live next to an airport, and when you first move in, you hear the planes every single day flying over your house, and your brain's like, oh, there's another plane, there's another plane. Well, years go by, and the planes fly over, and you don't hear them anymore because your brain has gotten used to it. And that's similar to how the hearing aids work with the ringing. You wear the hearing aids, and your brain just eventually stops paying attention to that ringing. Now, when you take them out, it's still going to be there. It doesn't eliminate it forever, but it helps you go on and function in life and get back to your daily activities and not have that aggravating ringing in your ears. So, a lot of people, what are the reasons why you think people wait to get hearing aids? What is that?
I said first week, I didn't.
So why do people wait to get hearing aids?
you sit down, you don't hear anybody talking, you know, until you realize, like, a table full of people, I can't hear what you're saying, I don't have my hearing aids.
Exactly. So we lose hearing slowly over time. So, you know, you don't realize, it's not like one day you wake up and your hearing's gone. You just lose it a little bit, and then the years go by and your brain gets used to not hearing. You kind of forget what it's like to hear the birds chirp and just little sounds like that. So that's why people don't realize that they have hearing loss. It's good to get an annual check every year just to make sure, see where you stand. You may have normal hearing, but we need to get a baseline and kind of see where you stand and what you're missing. Another reason is aesthetics. People think that they're huge and bulky and, you know, like they're going to make you feel old. When in all actuality, if you think about it, they're going to make you young again because you're going to put that hearing aid on, you're going to get back into society, back into, you know, going out with your friends, back into restaurants, and you're as young as you feel. If you know, sit by yourself all the time, you're probably going to feel old and outdated. But that hearing aid can really get you life and give you that young life again. Quality of life is a huge thing also. Another reason is price. So people don't feel like paying the money, they feel like they don't need them. You know, that's up to you, but in my opinion, you're replacing one of your senses, and if you take good care of your hearing aids, they can last 7+ years. So if it's a one-time expense, and it's really worth it. Also, a big thing is research shows that after many years, if you wait and don't do anything about it, when you do go to amplify, your brain's not going to work as well as it did, and you're never going to get that hearing all the way back. So that's a huge reason why you should always act now and stay on top of your hearing health care. All right, so at our office, we do offer all the audiological testing. I'm on the back now. We offer hearing aids and assistive listening devices. Do y'all know what assistive listening devices are? So that's something besides a hearing aid that helps you hear. Sometimes